Hello everyone. Welcome to Management Theories Used in Veterans Health Administration and Information Technology. This video is brought to you by Artez, Iswoya, and Yakira.
Over 100 years ago, President Hoover proposed consolidating agencies administering veterans benefits. And the following year, Congress created the Veterans Administration by uniting three bureaus that consist of VHA, the Veterans Health Administration, VBA, the Veterans Benefit Administration, and NCS, the National Cemetery Services. The VA has made extreme progress developing policies and procedures, but still have also faced challenges implementing those components to enhance critical elements such as the impetus to transfer, leadership commitment for quality, improvement initiatives that actively engage staff in meaningful problem solving, alignment to achieve consistency of organization-wide goals with resource allocation and actions at all levels of the organization. And lastly, the integration to bridge traditional intra-organizational boundaries between individual components. This research provides a summary of the Department of Veteran Affairs OIT services and the improvement approach VA TAMPS, which stands for Visual, Analysis, Team, Aim, Map, Measure, Change, Sustain. These core principles are embodied in VA's continued focus on advancing toward the strategic goals established to transform the VA into an innovative 21st century organization that is people-centric, results-driven, and forward-looking.
Okay, in these next couple of slides, I shall go over the literature review. Um, First, we'll begin with TAMIS, which is the VA's uh, management theory, kind of like the theories we covered in our chapters in our books. They use something that's close to the Six Sigma. So TAMIS stands for Team, Aim, Map, Measure, Change, and Sustain. These are the elements for the literature review. Team, the element for team, does everyone who touches this process have a say in the process changes? Aim, what is your aim or goal? Map, have you drawn a picture of the process? Measure, how do you know a change is an improvement? Change, what changes are making to improve? And sustain, if everyone on your team retires, how do you know these change strategies will continue to be used? Um, for the next slide, we have PDSA, which stands for Plan, Do, Study, and Act. In these elements of the literature review, plan the test or observation, including collecting data. Do, try the test on a small scale. Study, study the results and analyze the data. Act, or refine the change based on what was learned from the last test. And on the next slide, I shall go over DMAC, which is the Six Sigma uh, management theory, or Lean Six. Uh, D defines the problem, process, customer requirements, and it is an important tool used in a project charter. Measure is the element that collects, compile, and displays data. Analyze is the element that process details to improve opportunity and minimize error. Improve is the element of generating solutions and ideas that are verified by the project sponsor and the Six Sigma team. Control is the element that tracks stability of improvements and predictability solutions with control charts.
Our research question is how implementation of VATAMMCA's management theory helps veteran affairs to work as per their mission. This is the flowchart used in VHAID: vision, analysis, team, aim, map, measure, change, sustain are the steps. In vision phase, Project manager, team leader, client will work on defining project mission. Expectations from the client are noted down. In analysis phase, key processes are identified like business plan, budget of the project, and checking the background data. In team phase, team formation is the primary goal. Project charter is also defined in team phase. Project charter consists of project background, scope, and deliverables. In aim phase, a written, measurable, time-bound statement is proposed. VHA's aim is to reduce the illness and increase the health status. Tools are defined in such a way to work for it. In map phase, the benefits of flow mapping are utilized. Flow mapping helps us to identify the current stage of the project using start, end, and key decision points. In measure phase, the above set criteria are measured with the expected result. Various tools are used for it. In change phase, the changes required for the improvement of the project are identified. PDSA cycle is used in VHAIT. In plan, the data to be tested are collected. In do, the testing is performed and outcome are documented. In study, the tested result are evaluated. In act, as per the outcome, the modification of the product is done and it is retested again. It is very important to sustain with the result. Periodic monitoring, product support is performed in order to sustain with the result. Thus, VHAIT's mission and goal are accomplished by VATA MMCS and it helps in continuous improvement for them.
In conclusion, TAMIS, PDSA, and DAMAC are management theory elements used in the Veterans Health Administration. Here's our references, and this concludes our video.